Sa akon, ang requirements niyo, tatlo na lang. NCP, drug study,
Journal.
journal. Wala. Ang case presentation nyo sa next nyo na lang na ang rotation. Kaya ka-unfair na wala preparation. Okay. Wait. So, anyway, may group chat man. Depende sa ilan na decision dito. Pero para sa ako niya, no need na kay I do not like to spend again sa ano. Tama na to, kung ano, ma-order lang food or whatever. Depende sa ila to. Pero kung as much as possible, wala na. Para
Pwede nga per early, yun na lang ulang
per na lang kita, per ano.
Or RLE to.
Okay,
Whatever na lang dala.
whatever na mga
Wala man
design.
gisan to atong.
Anyway, tomorrow, ma-report lang kita 1 o'clock. Kahit sila to ba si 1 o'clock sila. Or pwede ko sila ma-message nga, we'll report 2 o'clock and then we'll start the devotional. I do not know sa ila kung matang post-test. Pero kaya gusto ko yan may post-test. And then, by 5 o'clock or by 4:30, 4 to 5, pwede na kita ka off. Yes.
Karon uli na. Karon duda sila preparation sila.
You will help. Sino di ang members ng council? Wala. Okay, wala. Basta you will help kung ano da karon. Anyway, so tomorrow may post-test kita. Tapos ang post-test. May actually more on case scenario yung pa-friend ko, yung pa-friend. Okay, so ang inyong ABCCs ha, airway, breathing, circulation, ano pa gani? Consciousness and safety. Okay. So, my question dila sa case scenario nga number 1, I have 2 questions. I have 2 questions. It will entail 2 answers. Okay. So, when you assess the airway, ano ang mga additional information that you are going to what? To observe. Ara na bagla sa inyo nga sa video ito nga ginhatag ko. Wala na open. Anyway, so, okay. Hindi ko of course. So, you have to choose. Assess for the presence of radial pulse. Okay. So, ara na yang assessment sa radial pulse, ara na yang clothing of the patients needs to be changed. Importante pala ina that you need to change the clothing of the patient. Those are some other information. And then, what about the position of the patient? Karon to yung kung nag-aamo na yung patient abiyo, tapos poor na ang iyang airway, breathing, and circulation, ang position niya nag-aamo na. So, do you need to consider the position to be changed? Jose? Yes. Okay. What is the other one? What about suctioning? Is it important?
Yes, ma'am.
Yes.
For airway clearance.
And what is the correct position of the patient?
Ako.
Or side lying?
Side.
And it is there where you are going to do suctioning to prevent aspiration. Okay, very good. And then, there are 2 things also that you must consider when you assess the breathing of patient. Ano ina siya? What are the 2 things that you are to consider when you assess the breathing, ha? Ang pagginhawa sa patient?
Rhythm.
I-consider na bala ang iyang level of consciousness? Hindi siya yung stroke. Okay? Now, what about the rate? Pag ang ease or ang flow sa iyang breathing. Okay? And then, what about the response of the patient? Is it important? Na-assess nyo na, so wala siya response, no? So, ara na iya. Given na iya, wala siya response. What about the effectiveness? Effectiveness ng entrance ng oxygen. Will it help sa breathing kung ang entrance or ang flow ng oxygen is okay or not? Yes. Sila. Anyway, so oxygen is very important. Okay. Hindi niya mo ha. Although some questions are here, pero in scramble egg ko. Okay. Now, if there is no pulse, wala respiration, no response, ano nang himuon mo?
CPR.
CPR na. Call for help na, no? CPR. Okay, dito sa Glasgow Coma Scale, let's see. A 53-year-old man named Fred admitted siya sa emergency department. Okay. Thursday ni siya na-admit o 21st of October sa inyong hindi siya na duty. Now, na motor accident siya. Ginpamangkot siya sa iyang name. Sa record, ang name niya si Fred. Okay. Now, pagpamangkot niyo, kung sino ang ngalan niya, pag kung diin siya, pag kung anong bulang, ang sabat niya, name niya kuno si Oscar, tapos pero ara siya sa hospital, and then pamangkot niya kung diin December ni kapit na lang Christmas kay damo na okay man ang iyang abi niya December. Now, ina siya na response and score sa iyang Glasgow Coma Scale. For every question, duha na ang isabat niyo, ha? Ang response and the score. Okay? So, sa Glasgow Coma Scale, ara man ginbutang ko man na ang isang Glasgow Coma Scale. So, sa response niya, verbal response, oriented bala siya to time and place? No. Okay. So, pila ang score sang oriented to time and place? 5. Is he confused? Yes. So, ano ang score? 4. Okay. Inappropriate words, hindi man. Maintindihan niyo man. Okay. So, incomprehensible sounds? Hindi man. Okay. So, what is the score?
4.
Okay. What about you approach the patient? Eyes niya wide open, nagatanaw sa imo, nagakadlaw, nagasmile. Okay. Ano ang response niya and the score? Ara siya sa best eye response. Ano na siya? Eye opening to sound. Close eyes niya, na may music, ang mga pag-open niya. And then eye opening to pain, close ang eyes niya, ginkusi mo siya, ang mga open niya, or no opening at all. And then spontaneously. Okay, so what is the score? 4. Okay, so you have eyes open spontaneously and 4. Okay. What about sa motor response? Okay. You instructed the patient Fred to raise his right hand and he immediately obeys what you instructed him to do. Okay, 6. So ano ang total score?
15.
Ay,
hindi.
13.
14. 14?
1 lang man. Minus 1 lang.
Minus 1 lang.
18 yun.
Okay.
Yes.
Yes. 14.
The total score is 15, ha? 15. Okay, so iniho, ano ang mga forms? So your patient, si Fred, is for OR. Kaya na-accident siya. So, for OR siya. Ano ang 3 important forms that you are going to prepare? Ano?
Informed
Pre-op
consent.
checklist. And then,
Informed consent.
una-una gid OR report. Kaya i-report nyo na siya. Pila gani kabilog ang OR report? 3. Diin siya makadto. Business office.
Sa ano?
Chart.
Nursing director. Charis.
Okay. NSO. That's in the director's office. And din ang isa.
Sa
Ano na, ma'am?
OR.
Sa ano, ma'am?
Di na
Sa
mabisa.
physician. Ay, ano ay
wala
ma'am,
akong
physician?
physician?
Di ko-
Okay. Di, maoperahan ang ayan ang patient nyo kung hindi nyo paghihatag sa OR.
Business OR nursing director.
Number 1, gidya nga ihatag nyo sa OR. Tapos, business office. Next sa DN.
NSO.
NSO. So, those are your nursing service office. Those are your OR report. Slip,
National
ha?
Statistics.
OR report slip. Ano pa?
Informed consent.
Informed consent.
Apat.
What else?
Pre of checklist.
Pre-op checklist. I'm only asking for 3. Ang ginamin ko yung tatlo na kabilog nga sa NSO, sa OR, kag sa BO, Business Office, amo na iyaya ang OR report.
Dili ka kadto ang
Diin makadto. You should know that kay nga level 4 na kamo. What about your patient is for CBG? Ano ang equipments na i-prepare ninyo? Do not mention to me cotton balls kay mas ginaga-injection ka mo may cotton balls ginaya. So what are the
SB
3
machine. SB
what
machine.
do you call that
Lancet.
machine?
Glucometer.
O glucometer
Lancet.
or
Lancet.
CBG machine? Machine. Strip, lancet, and test strips. Ha? CBG test strips, kay mayurin test strips man bala. Okay, so you have to write there CBG test strips in any order. Okay. Now, your patient is 74 years old. Kinanglan niya operahan sa mata. However, may hypertension siya, diabetes. Okay. So, what the doctor ordered for cardiopulmonary clearance. Ano nga procedure, diagnostic procedure ang inyong, ang i-order sa doctor?
ECG, X-ray.
ECG kag X-ray. Cardio mo. So, cardiopulmonary clearance X-ray. That's right.
Yung mga decision mo.
Now, what is the kind of stroke that has bleeding?
Hemorrhagic.
Hemorrhagic. Ischemic ang isa. Okay. Else. Now, Are, this needs your critical thinking skills. Patient Jose, 63 years old, diabetic for 10 years, came in emergency department on October 27 or 26 at 5 p.m. with the following admitting orders from his surgeon. Nang diabetic siya, ang iya, I think this is not in your, sa inyong, sa kanay mark in may ray amputation siya of the second and fourth digit left foot. Ang iya lang foot. Okay. Ang iya nga ano gani nga toes may i-amputate, no? So they call that ray amputation of the third or the second or the fourth toe digit, no? Mga toes. Okay. Now, ceftriaxone sodium or Stasif, 1.5 grams IV as stat dose, then 750 milligrams every 12 hours ANST. Now, orders ng Dr. Pagida mo ni, aside from that, is to inform OR, secure consent. Please refer to internal medicine for co-management and clearance. Now, from the above case scenario, ano ang imo nga unahon nga himuon? Okay, if you are the student nurse assigned to the patient. Ang order, ray amputation of the fourth digit left foot. Ceftriaxone sodium, Stasef, 1.5 grams IV as initial stat dose, meaning to say, ihatag na yon. After that, 750 milligrams every 12 hours na. After negative skin test. Okay. And then, inform AOR, secure consent, pag i-refer sa internal medicine for co-management. Now, Jose, if you are the nurse in charge,
Patient, ang patient.
ano ang inyong unahon? Ma-report ka mo sa OR, anay? Or i-amputate nyo na? Or i-refer nyo? Ang referral sa internal medicine, hindi ni aton obra, iyan isang surgical doctors. Okay. So, ano una mo?
Consent.
Maano ka mo?
Consent mo.
Hindi.
Sa medication, may start,
IV?
What is in the medication?
Ang sa IV.
may start order. Ito mga
Yes.
IV.
May stat order. So, ano, ANSTD ho?
may skin test pa siya dahil.
So, skin test, anay ka mo. You prepare the medication, Stasef. Okay, Stasef, that's the brand name. Stasef Triaxone. Prepare nyo and do skin test. Okay. Now, after doing the skin test, you wait for 30 minutes. While waiting for 30 minutes, i-prepare ninyo ang
Mga
what?
documents.
Documents for OR. Okay? Amo na iya. Do not wait for 30 minutes. After some 30 minutes, amo pag-prepare mo. So while waiting, prepare the forms. Ano nga nga forms ang inyo nga i-prepare? Kay i-inform OR.
OR.
Makambal nga mo na inform OR. Tawagan yun na ang OR. Ma'am, may ara kami nga patient for operation. Amo ni. And then, mahambal na ang OR nurse. Okay, hatag nyo lang di ang OR report. No OR report, hindi na sila mag-operate. So, immediately, so while waiting for 30 minutes sa results ang inyong intradermal, do your reporting. Prepare your OR report. Bain na anaya ang consent. Later naman na ang consent. So, prepare your OR report. Dira sa OR report, name of the patient, name of operation, name of surgeon, schedule of operation, date and time. Okay. Anesthesiologist. I forgot to my anesthesiologist. Okay. Yeah. Okay. So, amo na siya. Tapos ng exam. Para sa solving. So, gindelete ko man ang ang numbers na ikuha ko tayo sa case presentation. Tingnan mo case presentation. Now, Nurse Jeff will infuse 1 liter of lactated linear solution at 125 ml per hour via gravity flow using tubing calibrated at 15 drops per ml. Okay. How many drops per minute will it run? So you have to show the calculation. May ganit ni? You have to choose the number, pero hindi yun. You have to choose the answer. Pero, nandutang ninyo ang what? Formula.
Formula lang, ma'am.
What may
Formula ang pag-solve niya eh. Ang solving.
Solving. Formula lang.
Formula with solving, of course. Okay? Now, what is the nurse is administering atropine 1 mg IV to a 75-year-old patient with a heart rate of 45. Ang 45 is tachycardic na siya. What is the action of atropine? Ano ang action ng atropine? Atropine typically slows heart rate first and then increases it.
No.
Atropine increases the heart rate and improves the atrioventricular conduction by blocking the parasympathetic influences of the heart. This medicine is used to reduce saliva and fluid in the respiratory tract during surgery. So it's letter B. Okay. With a heart rate of 45, what is the action? Ay, sorry. Mali ako ha. Heart rate ang ginamin ko diri ha. Respiratory rate ang nasa isip ko. So very slow, very mabigo ang iyang heart rate. He is bradycardic. That is why atropine increases. Tingala mo.
Oo, ma'am. Tingala ko.
Habang ginabasa ko, ano daw ang na-mention ko to. Respiratory rate. So, bradycardia siya by nature. Pero, nag-lower pagid siya because of his ailment. That is why atropine is given. Okay. Now, what else? Patient, 72-year-old male, nagdala sa emergency department, chief complaint niya, non-productive cough, and fever of 38.9 degree. Tananin yung mga case scenario, mga cases na sa AR ha. As a student nurse assigned to the child, 2-year-old I mean, you administered ipaprotium bromide and albuterol sulfate now, then every 6 hours thereafter. The classification of this medication, inhalation na siya, ano ni siya? Cough expectorants,
Ano?
cough suppressants, anti-asthmatic, and COPD preparations. All of the anti-asthmatic. Okay.
Ang albuterol.
Albuterol, ang
medication.
sino ka ang nakapa-inhalation? Oo, sino to ang patient? Okay.
Albuterol.
What about medication that is indicated nga mag-reduce ang pulmonary inflammation because the patient has pneumonia? These are corticosteroids or steroids. So it could be
Inflammation.
Aminophylline. Aminophylline is not. Ano ba ang isang aminophylline? Ano ang mga steroids? So they are given corticosteroids. Okay.
Bronchodilator.
Yeah, bronchodilator ang aminophylline. Okay. Example of corticosteroids. Mga very common, ginahatag. Ano ba niya? Prednisone. Prednisone. Okay. Now, this nursing problem, kinanglan balaan mo ang definition sa nursing problem. Kaya kung kaisa, magagamit lang kita, wala ta kabalong sa definition. Okay, so this nursing problem is defined as excess or there is deficit in oxygenation and or carbon dioxide elimination at the alveolar capillary membrane. What is this? Ineffective airway clearance, impaired gas exchange, excessive mucus secretion, or tissue perfusion?
Ang B, ma'am. Gas exchange.
Impaired gas exchange. Because there is a problem in the exchange of your carbon dioxide and oxygen. Okay. What about this one? It is the inability to clear secretions or obstructions from the
Airway clearance.
Okay. Ineffective airway clearance or impaired airway clearance. A 45-year-old male came in ER with gunshot wound. Sa inyo ni I think.
Yes, ma'am.
On the left femur nga siling niya, na disgrasya. Tapos tabuan mo ito nga iyang bata ara sa ano, sa na-allergy. Oo. Pero bilib mo po ito sa mother, wala. Kaintiro sa iya.
Ano to? Ang pulis to gali?
Ang laki?
Oo.
Ang lalaki?
Mabati ko wala, hindi sumusa. Si pulis to, basi ito mga operation ko, mga secret. Pulis siya. Kaya dahil
By a gunshot. So what is the correct definition of trauma in this case scenario? A disordered psychic. There are different kinds of trauma. Let's have mental. Okay. Ano yung mental trauma? It's more of, it can also be considered psychological. For example, na bigla na disgrasya o napatay or whatever nga nag-cause ng mental problem sa iya, no? And then, physical naman niya, okay, nahulog siya, o what, nawala asang wound. Pero kung may wound, kung may open wound, so that nga may nag-penetrate, like say, blood some tree or what, so that is already penetrating trauma. Okay. So what is the correct definition of trauma in this case scenario? A disordered psychic or behavioral state resulting from severe mental or emotional stress or physical injury, or an injury to living tissue caused by an intrinsic agent, by an extrinsic agent. Extrinsic agent. Now, this kind of trauma is defined as when an object pierces the skin or body, usually creating an open wound. Penetrating. Okay. So, I think that is all.
Ito pala, ma'am.
40 na to, ma?
Kay balan mo, ang computation is 5 points. So, may harap pa. Sa Glasgow Coma Scale, okay, assessment, may video ako dadaan about the trapezius squeeze, fingernail bed pressure, okay, supraorbital pressure, Okay, or none of the above. Now, during the Glasgow Coma Scale assessment, the nurse applies a central painful stimulus to test the best motor response. Which of the following is not this type of stimulus? Okay, so you will check, for example, the pain stimulus of the patient or pain stimuli of the patient. Now you have the trapezius squeeze. May ara ka mo da. Ginano ko na ako. Tagal ako na sa inyo. You have the fingernail bed pressure. And then you have the supraorbital pressure.
Fingernail
Video, ma'am.
Pareho? Pareho. Na. Tatlo na sila. Trapezius squeeze.
Due to a patient to get a response.
Okay.
One time is called a
It-
central
it
stimuli,
demonstrates what
and the
is a
other one is
trapezius
a
squeeze.
peripheral stimuli. A central stimuli is when pressure is applied to the center of the body or its core to create pain. And this tests the brain's response to that pressure/pain. So there's a few ways you can do this. One way that's typically used first is through the trapezius squeeze. And you use your index finger and your thumb and squeeze about 1.5 to 2 inches of the trapezius muscle. And as you do this, you will start out and increase the intensity or pressure on that muscle for up to 10 seconds and then note how the patient responds. If no response is noted, then you can move to supraorbital pressure. And this is found around the eyes. If you go to the eyebrow and go to the inner part and you just feel with your thumb, you can feel a notch. And here you will gradually apply pressure for up to 10 seconds to that notch and note the patient's response. Now it's important to know before you use these pressure techniques to achieve a response in your patient that your patient doesn't have some type of injury. So for instance, if your patient has some facial fractures, especially around the eyes, you would want to avoid using the supraorbital pressure
Yes.
technique because this could cause further damage. Now another type of central stimuli that can be used is called the sternal rub. However, it's really not recommended to use this anymore because it can cause bruising in patients. The next type is called peripheral stimuli, and this is where pressure is applied to a peripheral extremity, for instance, like the fingernail bed. And this creates pain, and this will actually help test the spinal cord's response to pain.
When you are in ICU. No, when you are in ICU, you want to test the pain stimuli of the patient. You can use either your ball pen or the pen light. Pen light, pwede man.
Pinag-response siya.
Oo, pero ginamula niya buglo pala. Sige.
So that is better if may response ang patient. Kaya kung wala siya response,
Hindi niya ma-feel.
Pero ang sa stroke to, ang supiak na
Sorry.
may paralysis, why hindi naka-feel. Pero ang piyak, ng budget mo na.
yes. But you have to remember na maskin ang patient is in coma. The last sense na madula is the hearing, ha? Hearing. So one time sa ICU, may student, ang mga nurse, ginalibak nila ang patient. Siling ko, nag-rounds ako. Nurse supervisor ako at the time. Uy, ano nga nyo ginalibak mga nurse kag ang aid. Singko tanawa, balaho ang inyong patient, nagaluwa ang mata.
Patian nila.
Batian nila. Batian
Yeah.
niya, because that is the last. So in respect to the patient, may ara na niya aid. Kung early morning, nag-ano na sila, nagka-bath. Hala, paligo anang patient. Bawa, ba't si Lola, ni kabahos ang inuha.
Ay,
Coma siya ng mataas ang patient because she can hear. Okay. Can hear. So remember that na. Okay, so what are those three pains, central painful stimulus or stimuli that you are going to use? Trapezius squeeze, fingernail bed pressure, supraorbital pressure. Okay.
There's a...
Ay, sorry. Mali ako. Trapezius squeeze, supraorbital pressure, and fingernail bed pressure. Pero, may isa diri nga hindi part sang ano. Ando sa lang question ko.
Sulat na naman name mo.
Which of the following is not this type of stimulus? No. So, ano kay pag-ibig? So, doon na to yung ako i-consider kung kayo napaprint ko na to eh.
Di bonus ma'am.
Anyway, kaya pasubrahan ko mali 42 kay I'm supposed to give only 40 items. Ay usually kung mag-give ako sa post test, kung ginapasubrahan ko na kay isa hindi ko ma-final, I thought na final review ko na print na pagbasa ko, di ba?
Sala.
Kaya na-email ako na anak sa computer, wala. So, hindi ko pag na-print, ano lang pag ano. Anyway, i-review ko lang ni Anay, ha? Okay, so what else? Okay, I think that is all.
Ay, ti bonus.
Plus 5 na lang tayo mga.
Plus 5.
Ma'am. 135 lang na plus 5 40.
Plus 5 na lang na kung magkalinaon kita.
Wow.
Ay, matag ako post test. Di kita matag sa post test sa Saturday man.
Chapel.
Ato sa babaw.
Let's see.
Let's see.
Mitzi eh.
Kidi man.
Chapel na lang mo.
Ha?
Na-chapel lang. Ay.
Good luck. Galing magsulat sa chapel.
Tingin ka budlay sa chapel.
Sige, next.
Wala table.
Wala table.
Lagi din lang ito. May layuan eh.
Kaya hindi ako sure. Basta sa Saturday, we are not sure kung anong oras matapos sila exam. So anyway, kung early matapos, I don't know until what time na ang exam. Kaya may exam na sila sa aga, may exam na sila sa hapon. Perhan naman ang batch man.
Mas na mas
Hindi ko yung kaya nag-download ko. Hasta lang yung 37% ang download. Ayun lang.
Ma'am, pwede man ma'am si
Kami na lang din
edit tapos ikaw
isandan mo lang kami
Oh.
picture mo.
Oo, send mo.
Sige, Pim.
Send mo
Oo,
si
kami na
ma'am.
mag-generate. Sir De Ferio? Ito na nga, sir.
Sino to?
Sir Tato
Ay,
yun.
si tatay nag-change na.
Wow, nasi.
Pero mo sila na nagalaan. Kay Sir Ano muna?
Ang classroom mo. Uy, okay na. Sige, ha? They are calling already for the meeting. So, you just stay here.
Ma'am, send mo sa GC picture mo. Ay, pictures na ma'am. Send mo sa GC.
Sa din.
Sa ER.
Oo.
Diyan, sa cellphone ni ma'am. Ligad na, wala mo to. Ay, sa OPD, si Sa, kita lang to ng selfie, di ba? Cellphone ni ma'am. Okay po, video.
Sige.
Buwata mo.
I'll just go. Ari ka mo makadula ka mo ka.
Tawagin mo yung kantin.
Togon lang kami, ma'am.
Pwede.
Okay.
Togon lang kami, ma'am. O kami lang
Dahil shield na
nakatuto.
lang pala po. Porta mo. May gana ka pa
Kami lang nakatuto. Kamay mo matamato.
Sobra lang kami, ma'am, ng journal.
Yan, submit it tomorrow.
Ay, sino?
Okay, so mandi lang para sa
Kaya nga, ano, hi doon.
Sino mo ba
Kaya
siya?
na
Uy, kita na lang daw matamato.